Rob Portman. Rob, thanks for joining us this morning. The finger pointing never stops. What's a citizen to think? Who's blocking what here for trying to get something done?
Well, the Republicans are trying to add funding to the one program that's running out of money, and that's the PPP program through the SBA. It's the Small Business Focus Program, and by the end of this week, I believe it'll be out of money based on the burn rate per day that I'm seeing. So that's what Republicans are focused on, is you got a program that's already running out of money. Let's try to bolster it. I don't disagree. The program should be improved. Frankly, I don't think it works as well as it should for the hospitality industry and others who were shut down really by government edict. And we can talk about that. A couple of changes I think that would improve it. But in the meantime, let's not let the money run out. The other programs that the Democrats are talking about may indeed run out of money as well, but they haven't yet. In fact, they haven't even started in terms of the state and local government funding. And that will start this week. And, you know, $100 billion, $150 billion for state and local, $100 billion for hospitals. We don't know how much money we'll need there. So I think it's premature to add more money when the programs haven't begun yet. So I think that's really the difference. I don't disagree, again, with some of what Democrats ultimately are going to want to do in terms of testing, as an example. I do think that's something that's important. But let's also analyze how the existing funding is being used for testing.
Rob, just switching gears quickly, do you know the timeline for this new group that the president's going to put together? I think it's called an Open the Country Council or Task Force. Do you know who's going to be on it? Have you been approached? I think the president might have mentioned DeWine, the governor of Ohio, that you probably know pretty well. And do you know anything about that? And what's your viewpoint on how we're going to do this and how many different people we really need to talk to come to the right conclusion? That Trump said it's going to be his most important decision he's ever made in his life, when to reopen.
Yeah, I mean, it is an absolutely critical decision, and I think you ought to include some outside folks. I've made the recommendation that it includes some people from the outside that have the credibility that a Scott Gottlieb has. You just had Scott on. He's got his own report out called Roadmap to Reopening, I've seen, which is good. I do think some of the governors would be good. I also think some healthcare professionals, and I've talked to some healthcare CEOs who have said, you know, having the government shut down is also bad for health, and so we have to balance that. But look, Joe, it's going to be complicated. I think Dr. Gottlieb just indicated how complicated it is, because you've got different parts of the country that are experiencing different stages of the coronavirus, and so it might start reopening in different areas. He also talked about the fact that we need to continue to have a transition. In other words, there needs to be social distancing that continues even if parts of the economy are able to be reopened. And then he indicated, as is pretty obvious, some areas are going to be reopened more quickly than others, because in some cases, say, you know, everybody's sitting next to each other in a movie theater. That's not going to happen. Maybe you could do social distancing, but in other cases, such as outdoor work, you know, construction work, maybe you could reopen more quickly. So I think it's going to be complicated. I think having a group that's got some outside experts on it will give it more credibility, and I think it's good that we're starting to look at that.
Ohio probably isn't lobbying. You've seen the Governor Cuomo's appeal, and I think the governor of Maryland joined as well for relief for certain states that weren't included in the first package. Is that something you'd vote yes for?
Well, I don't know what that means. I do think, there are certain states that have been hit harder than others. In Ohio, we have 6,600 cases as of yesterday, 253 deaths, each one a tragedy, but we're in better shape than other states. So I think in terms of the healthcare response to this, there are some hotspots that need attention. In terms of how the money ought to go to the states, so I think it ought to be sent to the states per capita and not through any other analysis. There are some states that were in better shape than others going into this. This is not meant to rebalance that. This is meant to deal with the crisis as it stands. So based on population, I think makes more sense in terms of the funding that's going out. I mentioned the $150 billion.
Yeah. When did Governor DeWine shut down Ohio? What was the date of that?
It was early, Joe. So it was end of March. We shut down schools, shut down restaurants, bars. Started the process earlier than other states. And And it's paid off for us in the sense that our curve is less steep, and we've had, as I say, relatively fewer fatalities as compared to what was projected.
Yeah. You think you could have shut down Ohio or you think President Trump could have said shut down Ohio in the first week of February, and that was feasible to do that, Senator?
I don't think people would have accepted that because we didn't know the degree of the problem at that point. I think there are lots of ways to look back and say we should have known this or should have known that, but the reality is we just didn't have the information, and now we certainly do, and we know that social distancing works. We know that wearing masks out in public is a good idea. We've learned a lot, and we ought to continue those practices even after we reopen, in the sense of being cautious and using hand sanitizer and washing our hands and wearing masks. I think there's a way here to have a transition to a full reopening by continuing to practice many of those guidelines that the CDC has laid out.
Hey, Senator, you just made the comment that we didn't know, look, we're learning every single day new things about this virus, the severity of it, how it works with asymptomatic people versus symptomatic people, and all of that. And I know we're not, as people say, this isn't necessarily the time to finger point, but you do look back, and I'm not necessarily sure that we could have closed the world in February or February 1st per se. But how do you look at some of the reports now about what the administration knew during that period, and even efforts effectively to downplay those reports to the public, because that was what was happening repeatedly? So when you say that we didn't know, one of the reasons we didn't know was because we were being told by the administration, the president in certain cases, that it wasn't really a big deal, even though there were people inside the administration who clearly thought it was.
Yeah, Andrew, I think there'll be plenty of time to go back and analyze this, and I plan to be part of that. I'm on the Homeland Security Committee and a subcommittee that looks into these sorts of things, and there's a lot to be analyzed here to prepare us for the next one, and that's the point. But we are where we are, and the focus now ought to be trying to improve the healthcare situation. We're not going to reopen the economy. We're not going to do any of this unless we get people secure and confident that what we're doing in terms of the healthcare crisis is effective. This is why I mentioned earlier, Andrew, more testing is necessary. I heard Dr. Gottlieb talk about more testing per week, 1 or 2 million people. That's a minimum to me. I mean, we've got to have more diagnostic testing first. The new testing, as you indicated, that helps to determine who has the antibody is important also. But frankly, we need to perfect that test, and we need to know better, how accurate it is. But the most important test still remains the diagnostic test. We should be testing everybody who's got symptoms and then move to people who are asymptomatic so that you have a criteria that says how many new cases do we have every day and have enough data to make that meaningful. Only then, I think, a 2-week lag time after we see progress, are people going to feel comfortable to go back to work and send their kids back to school.
All right, Rob. I see DeWine's. So you think shutting down in late March was pretty good, though, and he's got like 80 or 90% approval rating, I think.
Yeah. I think he's done the right thing, Joe, because it has worked. You got to look at the results, and and again, therefore, he has some credibility to help us to be able to reopen it in the right way, to slowly start reopening parts of the economy, to ensure we have the data out there from the scientists, which I think is going to be the number of cases per day, the number of new cases per day. It gives people the confidence to know that it's time to reopen, it's time to get back engaged with the economy and back to school.
All right, Senator. Thank you. I appreciate it.